Hey, you guys, and welcome to season 2 of Tea Time with Dagan. I'm so excited that we are having another season come on, and it's going to be a little different this season. We have video, so you'll be able to watch that on YouTube, and I will still be coming in through Apple and Spotify as well. I'm super pumped for the guests that will be on here this season and can't wait to hear what you guys think. So grab your tea and kick back and relax and enjoy this season with me and my friends.
Okay, I'm so excited. Okay, so today we have a special guest. Everybody's special. I say that all the time. But Miss Natalee Emerson. I'm so excited to have you on. This was kind of like a last minute, hey girl, I really want to interview you on the show because your story is wild and a miracle and has Jesus like all over it.
Oh, yeah.
And just very full circle. So before we get into that, introduce yourself. Tell us a little bit about who you are.
Yes.
And then we can get into it.
My name's Natalee Emerson. I feel like we've literally, our parents' mothers run.
Yes. Oh, yes.
I'm pretty sure they're together right now.
Yeah,
actually,
they probably are.
So,
yeah, our moms run together and they taught together.
yes.
And that's how they met.
Yes.
Yeah. So
yes.
that's how we know each other.
Yes.
Yeah.
A little Ardmore. But I grew up here in Alabama, and I was, obviously we're going to get into the story, but diagnosed with leukemia when I was 16. Ended up graduating high school, moving off to Birmingham, going to Samford. Loved every minute of that.
Great school.
And then moved to Memphis, and now I live in Memphis, and I work at St. Jude Children's Research Hospital on the bone marrow transplant floor.
Wow. Very on that floor.
Very full circle, but also not because I didn't have a transplant. But.
Yeah. Okay. Okay. Yeah. Lots of stuff to get into.
Oh yeah.
Okay. Yes. So, I'm trying to think of how I want to dive into this. So, whenever, just kind of, I guess, start us off how the diagnosis came about. Because what outside looking in, I remember y'all went on a family vacation.
Yes. Yes.
And
no wonder I made it back.
Then, kind of tell us what happened. Did you start having symptoms there?
I had it before. So
Okay.
the spring of 2017, I had a really bad sinus infection that would not go away. So my mom took me to a little urgent care.
Yeah.
Nothing a good antibiotic and steroid shot won't fix. The reason we ended up going, I had the sinus infection, but I had a swollen lymph node at the base of my collarbone. And so we went, the sinus infection cleared up, but the lymph node stayed. So I got better, I felt better, whatever. So that was in spring. I go to my pediatrician that summer just for like checkup shots. I was about to turn 16, the whole thing. And we go in and she's like, I want to take care of that lymph node before we give you any shots or anything. So she gives me more antibiotics, doesn't touch it. We come back and my parents are starting to go, this is weird. Like, why is this not going away?
Right.
I started having knots on my head that, like, when I brush my hair, I didn't know that they were there until I brushed my hair and the bristles would like hit them and it would hurt. So we go back to the pediatrician and she says, we're gonna do blood work, we're gonna do chest x-ray, we're gonna do TB tests. She wanted to test me for tuberculosis.
Yeah.
I was like, okay, here we go.
Okay.
So
Thorough doctor.
correct. So we did all of that. It was all totally normal in June. Like, blood work was totally fine. Chest x-ray was literally everything was fine. So she tells me the knots in my head are psoriasis, but they were like under the skin. It was weird. So in the middle of, like, between June and July, my mom's dad passes away. So we're like dealing with that.
Yeah.
But we had our family vacation plan to San Francisco that year.
Yes.
And my mom was like, we're still going, that's still happening. So we go out to San Francisco, do the whole California trip. And while we're out there, I felt like really tired. I remember we're riding bikes across the Golden Gate Bridge. I'm out of breath. I literally cannot ride the bike. And my family.
Yeah. Her family's very active.
Her
Her dad and her mom.
Yes. And now my brother.
And
Nathan's
yes, Nathan.
gone off the deep end too. But so I remember them all being like, "What is like? Are you being lazy? What's wrong? Like, are you okay?"
Yeah.
They those words.
Yes,
But
they did.
so I just remember being like super tired. Well, then we ended up driving up to Yosemite National Park, which I love a national park. I can hike all day long. And my brother and my dad were like, "We're going up to this waterfall." We take out on the trail, and I'm like, I cannot. I feel awful. So mom goes back down with me, and we're sitting on a bench. It's 95 degrees outside, and I'm freezing.
Oh my goodness.
And
Natalie.
yeah, so we're sitting there, and obviously my parents weren't telling me at the time, but they were like, something is going on with her.
Yeah.
So we make it home. Somehow I made it home, and we got home late on a Saturday evening. Sunday morning, I got up and like washed my car because on our trip, I turned 16.
Mm-hmm.
So I had gotten up on that Sunday morning, washed my car, was like getting everything prepared. I was going to go get my driver's license the next morning and drive myself to volleyball practice. I was so excited. And that evening, we are like around the house. I'll never forget, my mom had made taco salad. I literally have PTSD with taco salad.
Sure.
And I'm sitting there eating it, and it's like 8 o'clock. I'm going, I'm going to have to go to bed. I feel this just weird, tired feeling. So I was like, I have to get up early. I'm just going to go to bed early, which I never did. And so I go to bed. 2 hours later, wake up sweating. And my mom checks my temperature. I have a fever. She gives me Tylenol. I lay on the couch. Fever goes up. So she wakes my dad up, and they're like, we're taking you to the ER. Something's going on. So take me to the ER. Overnight, running all kinds of tests. I got up and went to the bathroom at one point and passed the ER physician like at the desk, and I hear him say, "I think room whatever might have bad mono." So I like go back in the room. I'm like, "I've got mono. That's all that's going on right now. We're fine."
Yeah.
So I'm sitting in there. I fall asleep, and at some point, they came in and did more blood work, and they were like, something's kind of off. Like, we're still running blood work. We think it may be mono, but we're still working on it. And at 5 a.m. that morning, when I had my alarm set to wake up to go get my driver's license, the ER doctor comes in, he shuts the door, and says, "I don't have good news." He originally diagnosed me with lymphoma. We later found out it was leukemia.
Okay.
But he was like, "I think she has lymphoma. I've already contacted the oncologist St. Jude Clinic here, and she's told me what to start. You're going to be in Memphis this afternoon, starting treatment."
What?
Hello. And I just remember sitting there. My mom was like at the foot of my bed, my dad was to my left, and my mom's instinct was to be like, "Hold on, what?" Like, she went to ask him something, and I was like, "Mom." Like, I just remember losing it. Not like, I cried for like 10 seconds, and then I like went into this like whole kind of just jittery panic attack, which is exactly what it was. But at the time, I was just like, what is happening? Oh my gosh.
Right.
So they moved me to the PICU, and we ended up we started, I don't remember what they started on me, but I went to the PICU here in Huntsville, and then that afternoon sent me by ambulance to St. Jude.
I remember it was fast.
It was very fast. Very fast.
So how do you feel like your family like reacted to the diagnosis? Like,
I think that is one of those things you never expect until when those words are said, especially at the age of 16. It's just like, what is happening? I think we reacted as well as we could, if that makes sense. Like
was everybody's reactions different, or was it, or like, I guess?
I think yes and no. Like, everybody was shell shocked, and it's like a very emotional thing.
Right.
But then also like both my parents were like, okay, this is what we're having to deal with. Like, we're gonna face it. We're gonna deal with it. I think later on, finding out how different people emotionally went through it was interesting. Like, I remember later on finding out, because Nathan was in nursing school, like, here by himself. And I remember later on finding out, oh my gosh, like that really affected you a lot different than I thought it did.
Mm-hmm.
But handling it well overall, for sure.
Mm-hmm. Well, it's hard. I mean, that's like a
Yeah.
I mean, hard doesn't even
No.
cover. That's just a bad word. I don't even know how to.
Yeah.
There's no. If you could put a word to it, I don't even know if you could put one word
No.
to it.
No.
So kind of. So as far as what type of leukemia,
Mhm.
what did you have?
I had acute lymphoblastic leukemia,
Okay.
and then that can branch into two different kinds. So I had T cell, either
Okay.
T cell or B cell, and I had T cell.
Okay.
So,
So when you got to Memphis, like talk us through, like y'all immediately started treatments
yes,
immediately?
Yes.
Like what was going through your brain?
Oh my gosh. So my dad was in the ambulance with me, and then my aunt ended up driving my mom to Memphis because hello,
Right.
Let's not drive ourselves right
No.
now. So we get there. Literally, I remember they were like already trying to consent me for stuff before mom even got there. My dad was like, "We've got to wait on my wife. Like she's got to get here."
Yes.
So mom gets there. We consent. My oncologist like met him literally the second I got there. He comes in, gives mom and dad the breakdown. I think, and I have said this and will probably say it again. It, I think, affects caregivers sometimes a lot worse than the actual patient, especially in pediatrics. But like, because they had to sit my parents down and explain all that to my parents, and they weren't the ones going through it. Like they were making the decision for me. So I think that's really hard concept. But so we did all that on day one. The next day, I went, had my bone marrow aspirate, lumbar puncture, had my PIC placed. Had to do all that awake because, come to find out, I had swollen lymph nodes around my windpipe. The knots on my head were swollen lymph nodes.
Did they put your PIC line in when you were awake?
Yes, they did.
Explain what a PIC line is really quick.
A PIC line is a central line, goes into your central venous system so that you can have more access than just an IV.
Yes.
Because IVs are actually not
very invasive.
Very invasive.
Not just an IV.
No, it is a very sterile surgical procedure. Yes.
Anyways, I didn't mean to interrupt you. But.
No. That was very traumatic.
That is very traumatic. Oh my goodness.
The good thing about that was obviously a form of the treatment was having lumbar punctures all the time.
Yeah.
And because I had the first one awake, I did the rest of them awake. My bone marrow aspirates, no, those were asleep.
Yeah.
Did not do this awake. But so did all that the next day, started chemo that night. Like, I mean, it was rapid fire, slammed me so hard with chemo. My first week I was inpatient. Second week, so St. Jude has on-campus housing for their patients, which is such a blessing.
It is.
So the second week I was in Tri-Delta, but would like obviously come over to the hospital and get my treatment. And then they were like, can't really go home. So they moved us to the Ron McDonald house. That's right there, close to the campus. And we would drive over, get my chemo, go back. I did that until Labor Day of that year. So I was diagnosed. That's almost been 8 years. July 24th.
That's crazy.
So we did that until Labor Day. They let me come home Labor Day weekend, and then in October and November, I did 1 week of like inpatient chemo, 1 week at home. 1 week, so I would like alternate for those 2 months. And then in December of that year, I started what we call maintenance therapy, and it was weekly chemo for 120 weeks. So a little 2.5 years.
Goodness.
Which, yeah.
How did that make you feel when they said, you're going to have to do this maintenance therapy for 120 weeks?
Yeah.
I mean, that is like...
Yeah. Because it's like, okay, you get diagnosed with cancer, and you're like, okay, let's treat it. But the treatment's 3 years.
Yes.
Like, okay.
And that's most leukemias.
Yes.
It's a long process.
It is a long process for leukemia. So that was like hard to wrap my head around, and I don't think until I got like when I hit week 1 of that, I was like, oh, this is gonna be a while.
Yeah.
But thankfully, so the further I got out, the less it was. So like my chemo doses slowly got smaller.
Okay.
Like by the last one that I had, it was just a little chemo push. Okay. It wasn't anything crazy, but it it would still make me tired, but like not. The end was nothing like the beginning, because it wasn't high dose and stuff like that. But so yeah.
So you were out of school for a year, right? Am I remembering
Yes.
that right?
So
Okay.
my sophomore year, I was all online, which was terrible.
Yeah.
And then my senior year, I did half online, half in person, because there was like I couldn't be literally every single Tuesday of the week of every week. I couldn't be there, so I had to do most of it online. But
your senior year, did you get to go back full time?
No,
No,
I did
you were
it
still half and half.
Mm-hmm. Because
Yeah.
missing every Tuesday.
Yeah,
just really
that's true.
Like
you miss like 4 days, and
Yeah.
then you're like, oh,
yeah,
you got
I'm really behind.
You're failing.
Yes, yes,
That's so
yes.
true.
Yes.
So as far as like the treatment process,
Mhm.
are there things that like I'm sure there's things.
Mhm.
I'm sure you just pick and choose.
Oh yeah.
The most like difficult day that you had, and then what got you through those like really hard days? Was it your parents? Was it God? Was it all of it? Was it your nurses? Like
All of it.
give us some stories.
So I mentioned I had a PICC line. I ended up having a port. They didn't want me to have the PICC line. You really have to be put to sleep to have a port put in.
Yes, you
It's
do.
like a whole thing.
Yes, you do.
So I ended up having my PICC replaced with a port. Same concept for a port. Just prefacing that. But I just remember when people ask me like physically hardest, I remember it was like early stages. And a lot of it, like when I say it's worse on the caregivers, there was a period of time like in the early months that I really don't remember a lot of it, because I was so, I don't want to say drugged, but like you've got that much chemo in your system. This is your life. You don't want to think about it, but you have to deal with it every day. You feel terrible, so you're sleeping your life away.
Yeah.
Like I think that was hard, but then also I remember my liver got messed up early on from one of the chemos, and it was so painful, so awful, and I just remember like being in the middle of that thinking, oh my gosh, am I ever gonna like, is my liver gonna heal? Like, is this ever gonna get better? And then you know, I did not drink water. It was terrible. Don't do that. Drink water. Drink your water, people. But so I think like I remember having to figure out a way to make myself feel better in that. And so when I say it, like I don't remember a lot of it. The early stages I don't, but the Lord 100% carried me through that, and I didn't. Looking back on it, I don't think I realized how much He was in it. As like in the moment, I was like, I've got to deal with this, whatever.
Yeah.
But looking back on it, He definitely had His hand like over me in those moments. There's a reason I don't remember a lot of it, because it would be bad if I didn't.
Yeah.
So my Huntsville nurse. So something a lot of people don't know, I did not know this, is St. Jude. The one that I work at is like the big main St. Jude facility where all the inpatient situations go on. There are like 7 or 8 affiliate clinics that are across the Southeast that patients can go home and have their treatment there. A majority of our kids are outpatient, which a lot of people think like it does not make sense, but it does. Like our general population of kids on a normal human being would be inpatient, but we want them outpatient, getting their chemo in an outpatient setting. So all that to say, our St. Jude Huntsville clinic, those nurses are literally sent from heaven. So 16-year-old going through cancer treatment. You're a teenager, you're in high school, you're not getting to do the high school things that normal people do. And so I tell people my best friends in high school were my nurses, which is a very weird concept, but like they were the ones that were like always involved in like what I was doing. They wanted to know about my week. Every Tuesday when I went in, we talked. Looking back on it, I would always get home and be so tired. My mom, like, we thought it was my chemo. It was because we just talked the whole time.
Yeah,
like,
you're burning some energy.
Yes. I was just exhausted from just
that's
interacting
sweet.
with people. So I'm very grateful for my nurses, my family. I think, oh my gosh, I literally would not have made it without my parents. They were like my main caregivers.
Yeah.
My mom having to learn. My mom, squeamish. Love her, but squeamish.
That is so funny. And you and Nathan are in the medical field.
Yes. Me, Nathan, and now Adriana, also in the medical field.
Yes.
We get together and they're like, y'all got to stop talking about this. But, so she's squeamish, but the stuff that she learned to do while I was in treatment never once passed out. Never once got squeamish with me. Like it, that was
there you go.
That was the Lord though. Because like, I don't think she could have done those things without the Lord. So very thankful to my parents. I tell everyone my brother's the only one that kept it real. He is the only one that treated me literally no different, which in hindsight I needed a lot more than I realized. Oh my gosh, some very interesting jokes were made with Nathan, but it was what I needed at the time, and so I'm very grateful for that. I think it made our extended family a lot closer. I think when you go through something like that, and I do think if you yourself or someone in your household has never gone through it, you don't understand at all. But even like my close-knit family knows more than general population now, just with watching them go through that.
So for such a long time. I remember, and if you don't want to touch on this, we don't have to. I remember like when you were losing your hair, and was it your dad that did he shave his head with you? I remember like being so like I don't know what it is. I think it's just a woman thing.
Oh yeah.
Like, this is our hair. Does this feel pretty? And not only are you losing things as a 16-year-old, you didn't get to wake up and go and get your driver's license like you thought. And the list goes on. But then you lose something like that. Like, walk us through how that was.
So, I started, when I say the treatment was 3 years, it's 3 years to keep you in remission. So they hit me so hard with chemo that my 2-week post starting treatment, like literally 2 weeks in, they did a bone marrow aspirate and I was negative. But it's 2 years to keep it negative and then some. So I think around that 2-week mark, my hair started falling out. And it was like, I mean, if you have long hair, you shed naturally. So it started out like minor shedding. Okay, I'm used to this. Like, this is normal every day, whatever. Then it starts going into like major shedding. And I remember like when we were in the Ronald McDonald house, I had this towel. My mom would lay a towel on the floor and I would just sit by the bed and like comb through with my fingers and just pull it and like throw it on the floor.
What were you thinking? Were you like, I know this was going to happen kind of thing?
Yes. And one of my first questions was, am I going to lose my hair? They were like, you never know.
Yeah.
Thank you for the hope. You're going to lose it. So I think in that moment, I remember being like, this is probably going to affect me later. I don't think it really did in the moment. But I remember my aunt came to visit and she made it a lot better of a situation just because she was like making jokes about it and whatever. I just remember her being there when I was like really losing it. But so it started, this sounds disgusting, but you know how like when a dog's hair gets matted?
Yeah.
So when I would sleep, it would do that in the back. And it just got to the point where it was like, it just looked terrible.
Yeah.
So I remember my mom cut it off to like here. And then it just started getting like thinner and thinner and thinner. And then finally, I remember my dad, he had to come home a lot and like work and then drive back.
I remember that.
Many a drive to and from Memphis. But I remember mom being like, we need to think about you having to go like do this. Like we need to commit at some point. I don't know when you're gonna want to, but like whenever. And I remember being like, do it. Like there's no avoiding it.
Yeah.
We just need to commit. And so we called Dad and we were like, bring your clippers because it's time. And so he came, we did it, he did it in the Ronald McDonald House. It was just the three of us in the room.
Wow.
It was very, I think there's like a video, and every time I watch it, I'm like,
Well, say I'm trying not to cry
no, I
thinking
know,
about that.
I know.
Uh,
I think, like, when I watch that and I look back on it, it is something that not a lot of 16-year-olds go through. And when I think the aftermath of, like, I committed, I was like, okay, I've got to get rid of it, whatever. This is going to be a 3-year long process. Like, this is just the beginning. Looking back on it, it affected me a lot more than I thought it would. In that moment, I was just so, like, I'm dealing with it, I'm doing it, I'm blah, blah, blah. But that was a big one, for sure.
Well, and you said that. You said, like, things, like, in the moment, you were like, make a decision, get this done, like, what's the next step? But then it's affected you.
After.
When did you start noticing, like, things
I would
affecting
say
you, I guess?
probably, like, going through nursing school and being in situations where people talk about their high school. And they talk about, like, stuff that they went through, and it's not, I'm not saying, like, okay, yeah, you were fine in high school. Everybody goes through stuff in high school. It's high school. But, like, I think there have been situations just in college where people talk about their high school. And I'm like, yeah, I lost my hair. And then it's like, okay, Natalee, thank you. Now this is awkward. So
Well, I had cancer.
I had cancer. So yeah.
Oh my goodness.
Yeah. So
But that's hard.
it is.
It's like you want to have empathy, but you're like, but I don't with your little tiny whatever it is.
Yes. I've had to work on the compassion for sure.
Yeah.
For sure.
So what made you, did you always know after this that you wanted to be a nurse, that you wanted to go? So tell us about that.
Okay. So Nathan was in nursing school, or was, like, he knew he wanted to be a CRNA from day one. And I remember when he told us that, I was like, you got it. I want nothing to do with healthcare. I want absolutely nothing to do with that. And then I get sick, and Mom, the teacher in her, what do you think you're going to want to do one day? Like, what, you know?
Yeah.
Maybe you should be an accountant. No, you are the math teacher. I'm not. I did not get that gene. You've got it.
She is so smart.
She is. So I remember being like, I don't know. And so I just started kind of wrestling with that. And then I remember probably like halfway through my treatment, I started realizing how much my nurses meant to me and how much, like, they were going to mean to me. I still talk to them to this day. And I remember being like, maybe this is something I should think about. And then from that point, it was like, okay, nursing it is. And then I went from, okay, what kind of nursing do I want to do? So I was like, okay, oncology, for sure. Definitely. There's a reason I'm going through this. So then I went throughout college, I went through the battle of, do I want to do adults, do I want to do kids? I'm not moving to Memphis. So, like, if I do kids, you know. And
I love how we even plan and God just is like, they're laughing at us.
Oh, yeah. I'm like, I'm not moving to Memphis, so I don't know if I want to do adults or kids, you know. So I get into the middle of nursing school, and the college ministry I was in Birmingham with my church was incredible. And I remember one night randomly, like my sophomore year, he was preaching on just like falling and listening to the Lord's voice and like just being in tune with that. And I remember being like, okay, like I'll take this with a grain of salt. And so we prayed at the end, as you do, and Memphis comes into my head. And I'm like, you're joking. Like that's not happening. No, that was fake. That was my brain. That was not the Lord. Like not listening to that. So I think I remember the girls that I was there with, I remember telling them, and they were all like, yeah, that's funny. Like, no. So junior year happens, and we have another sermon in the college ministry, and it's about Jonah refusing to go to Nineveh. And in my head the whole time, I'm like, you got to be so real. Like, this is not happening to me. And we stand up. I hadn't said a word, and we stand up at the end, and my roommate, who's my best friend, she literally looked at me, she was like, Memphis? And I was like, girl, you know.
Did you tell her?
No. And I was like, first of all,
Spirit.
yes. I was like,
Goodness.
first of all, you should be praying your own prayer. What are you doing thinking about me? So that was just like, I remember being like, okay, I actually do have to think about this now.
Yeah.
So then I go through my pediatric rotation. And in nursing school, but you go through all the different clinicals.
Right.
And we do our pediatric clinicals at Children's of Alabama. And I remember it was always this whole to do when everybody got their clinical rotation. When that list comes out, it is like,
yep,
let's go.
Mm-hmm.
So I remember we're like getting our list. I had gone to the bathroom. I come back and everybody's like losing their mind because they know where they're going. And I get on the computer because they had like released it in class. So I like get on my computer and it says a quarterback. I was like, because their floors at Children's of Alabama are all named like really weird.
Okay.
And so I get and I'm like, what's a quarterback? What? And one of my instructors comes by, and it's me and like all my best nursing friends. We're sitting there, and they all know my story.
Mm-hmm.
And one of the instructors comes by, and I said, "What's a quarterback?" And she goes, "Oh, that's the hematology oncology floor," and walks away. And we all just went. I remember being like, and I looked down, and all my friends are just staring at me like, "You are kidding."
Yeah.
So I start my clinical there, and it was the first time that they had a clinical like group from Sanford there. There was like 6 of us out of our entire cohort. My instructors had no idea. I literally, the second that she walked away, I followed her to the front of the classroom and I was like, "Do you know my story? Like, did y'all do that on purpose?" And she was like, "What are you talking about?" And I said, "I had leukemia." And she was like, "Are you okay? Do I need to move
I
you?"
know, I'm about to be like, "Are you having PTSD right now?"
I was like, "No, this could not be more like obvious that that's where I'm supposed to go." So I go. It was incredible.
That's awesome.
At this point, I didn't know. I'd been thinking about Memphis, but I just didn't know what St. Jude, like how that would work.
Mm-hmm.
Well, then I found out that they have so a lot of hospitals now have nurse residency programs for new graduate nurses.
Yes.
St. Jude has one. Also another Lord thing because I had no idea.
Yeah.
So when I was hired, they bring you in, they give you like extra training at the beginning because Hutchinson doesn't really prepare you to be a nurse. So they like give you extra training, whatever, and St. Jude does it where you can shadow the entire hospital. So
very cool.
I got to shadow every floor, every clinic,
I love that.
every area, OR, like everywhere. And then we got to rank where we wanted to be. So I went through, I obviously loved the floor that I was treated on, but in nursing school I loved critical care.
Mm-hmm.
And St. Jude does have an ICU, but it's just a different type of ICU. It's just a different vibe than normal ICU. And then bone marrow transplant is like kind of best of both worlds. You get the oncology side, but then they can also be like critically ill. Mm-hmm. So that was cool. So I ended up I ranked BMT. They did this whole like matching process, very sorority match vibe situation going on. But so that's how I ended up with bone marrow transplant. But so all of that to say, it was very ordained by the Lord.
Yes.
There's my college was like the whole experience at Sanford was from the Lord, like 100%.
Why would you say that?
I think the friends that I made, the people I was surrounded with, called me higher, taught me so much about the Lord's grace, but then also like encouraged me to listen to the Lord. And I remember when I had decided, I was like, okay, I am gonna apply to St. Jude. I don't want to move to Memphis. What am I gonna do? And I remember going to my college minister, and it was him, my small group leader, and I remember like sobbing because I was like, I don't want to move to Memphis. Like it's not ideal.
Yeah.
And they were like, "Oh, yes, but you have to listen to the Lord. Like you can't keep running from that." Because if you do, you're still going to end up there.
Yes.
Whether you want to be there or not, you're going to.
Nothing can change his plans.
No, not at all.
So as far as like going through the treatment, in which, like you said, when you're in the moment, you were making decisions. It's just like, I'm not even processing this. When it came to, I mean, obviously, I'm thinking, what would I do? Okay, when I'm asking you these questions. So, like, if I get diagnosed, or my son, or somebody in my family gets diagnosed with this, I mean, there's almost like this begging period of like, please take this away from me.
Oh yeah.
So what did like your relationship with God from 16 to when you were done with treatments to now? How have you seen it grow?
I think so. Going through it, I remember being like, obviously, small town, Ardmore, love it. Yeah. Everyone and their mother is praying for me.
Yes.
And looking back on it, I think that was covering me more than I thought it was.
Oh, yeah.
Like, I remember just making those decisions, going through with it, and then in the aftermath being like, all right, those prayers worked.
Yes.
Because had it not been for that community, I don't think I would be where I am today. I think, so I was kind of in a period of like, just going with the flow when I was in treatment. I trusted the Lord, but it was like, okay, I trust that whatever happens. Like, you're in control. If I remember like telling my parents, it's a win-win. If I make it, I get a really cool story to tell. Little did I know, like, it's gonna be totally full circle.
Yeah.
And then I was like, if I don't, I'm with Jesus, and that is one of the most reassuring things and I just trusted that. Like, that was kind of my mindset throughout treatment. I get to Sanford, have friends, and like telling that story to strangers and them being like, whoa, you have been through it and you're here and you're happy and you're okay. Like, I remember that being reassuring, and then also with them being that way, plus adding, God did that. Like, He brought you out of that, and now you're here, and you're in school, and like, you're living your best life. And I think Sanford, the church I went to down there, the friends I made down there were definitely placed in my life for a reason. And it was to pull me out of the mindset of like, cancer's not my whole life.
Yeah.
It is a huge part of it, and I'm very passionate about it.
Yeah.
But, like, I think learning about the Lord and what He did through me during that while I was at Sanford was a cool turnaround. And I learned so much about His ordainment in life when I was at Sanford, looking back on it. And then just being in nursing school, that's hard in and of itself.
Oh, my goodness.
And being with those people and being in those moments of being in the hospital and you're like on the other side of it. I think too that played a huge part in nursing school. I was like, I'm actually on the other side of this now, and I get to see it from a different angle. So relationship with the Lord really strengthened in college, like tremendously. Yeah. And I give the obviously all credit to the Lord, but I think He used that church that I went to for sure. And then, so learning about Him there, then I moved to Memphis, and I've been there a year now.
Yes.
And I love it a lot more than I thought I did.
Okay.
So that's awesome.
Not as scary.
Not as scary. There are some really good parts of it.
Okay.
But I think being on the other side in the same hospital and like learning to love these kids in a way that they feel seen has been totally, like, it has ramped up my faith even more. Because yes, because there is no other explanation for why I'm doing what I'm doing every day other than the Lord. Because if I did not have my faith, I would not be doing what I'm doing. I couldn't be a nurse if I didn't have faith, much less a pediatric oncology nurse. Like, that is in and of itself from the Lord. I think, so there are just little things, which obviously in college, like dealing with listening to the Lord and the stories and stuff, but there have been just times where I like go to church or I'm in small group and we're talking about something and it just like clicks, like, oh my gosh, you are the Lord has done you such a kindness by bringing you to this point.
Mm-hmm.
Um,
Divine just appointments and
yes,
setups.
yes, in some of the most random ways.
Mm-hmm.
I had a little girl this past week who, like, I think she's 9, and she was having a full-blown emotional breakdown right before bed. And I went in and she's sobbing. Her mom had gotten her out of the bed. She was sobbing, hyperventilating. And I got down next to her, and I had told I'm very picky about what families I tell that I was a patient, because it can go one of two ways.
Yeah.
But I had told this girl and her dad. Well, her mom was here with her, so her mom didn't know. And I got down next to her, and I thought she was hurting. I didn't know it was emotional.
Mm-hmm.
And she is unwell, and her mom looks at me and she said she saw a picture of her brother, and he got a haircut, and she can't see him, she's missing him. And she's like,
oh, goodness.
I know. And I start tearing up, and I look at her and I'm like, I know I've told you before, I don't think you remember, but I was a patient. I get it. I know what it's like to not be living the life that everybody else is living. It sucks. It's hard. It's okay to feel what you're feeling right now, but I'm here for you, and I understand. Immediately stops crying, yawns, gets to bed, and falls asleep. And I just remember walking out of that room being like, this is why I've gone through what I've gone through. In high school, I think I was so, like you said, why God? Why? Asking those hard questions, and then getting to do that. I'm like, this is why. This is why I went through what I went through, so that I can be here for these kids that are going through exactly what I went through. Yeah.
I cannot imagine, sorry, I'm trying not to cry. I'm blinking 100 times if y'all are watching this on YouTube. I'm such a sensitive person.
Oh, me too.
It's so
I
bad.
cry if I'm mad, if I'm sad, if I'm happy. There's tears 99% of the time.
But I remember going through my nursing rotations of clinicals, and just kids.
Mm-hmm.
I don't know why. I was like, no, I cannot. I will cry every day.
Mm-hmm.
But the strength that you have, that God has given you,
yes,
to walk into that room of a 9-year-old girl, that is not fair. Cancer is not fair.
No.
However old you are.
No.
But childhood cancer is this brutal thing that I can't even wrap my head around. And to care for them, you were made for that.
Yes. And that is something that it is so funny every time I tell people what I do. They're like, how? Yeah. And I'm like, I don't know. Not by my strength. That's
the
for
Lord.
Sure. The Lord and the Lord alone. Because I should be weeping at that story, but in the moment I'm like, I get it. I understand. This is why I'm here.
I'm sure it makes you an insanely incredible nurse. I'm sure it does.
It definitely helps for sure.
Yeah.
Sometimes I'm like, oh gosh, this is when I get 4K is the leukemia lymphoma 4, and I get floated up there sometimes. They need extra nurses, and a couple weeks ago I had a kid, day 4, same protocol I was on, and I remember being like, I cannot do this. I get the leukemia side on bone marrow transplant, but I didn't go through transplant, so it's it's the same, but it's different. Yeah. So I have that little disconnect from it. Yes. But every time I go to 4K, I'm like,
I was gonna ask, do you get I hate to say the word triggered, but do you get?
Yes, I have a healthy level of PTSD for sure.
Did you have to do counseling after all this? Did you ever?
I should have.
Have you ever?
No, I should have.
Natalee.
I think the Lord is incredible, first of all. He is. But I also think he definitely can work through therapy, and I should have gone, but I didn't, and here we are. Maybe I'll go eventually. I don't know.
Oh my goodness.
Yeah. But so the 4th floor, I remember when I was doing my rotations and getting to see the whole hospital. Literally one of the days I was there, we had a kid in the room that I was in. And I remember walking in and being there's this big picture on the wall, and I remember this child is in the bed, in the room that I was in when I was at my lowest point in my life. That was crazy. And the nurse I was with that night, she said she remembers my parents. She was there in 2017.
Wow.
So she says she remembers my parents. She didn't really remember me, but I remember being in the same room. and this is
What is
scary.
happening?
This is scary.
Yes.
But I think it is cool now to be on the other side of it and to understand what they're going through. Yes, it's hard sometimes, especially like with kids who, right when I got there, when I started on BMT and started going through orientation, there was a kid who had B-cell ALL who had like relapsed a ton of times and he had gone through like already 3 transplants, and then he was super sick, and my preceptor put me in the hardest of situations way before I was ready for that, and I remember like he ended up passing away, and I remember later on being like, I need to think about that. I need to process this because I know that's affecting me. I'm just not like allowing myself to be affected by it. So
just shoving it down.
Mm-hmm.
Probably don't want to go there because it's going to bring it all
back
up.
It'll be a rough time.
So going through that, what would you say is a good day for you? You know what I mean? Like, I mean, you experience the worst of the worst.
Oh, yeah. I think I have a much more appreciation for simple. Like, I can make the most of a worst day. I think it can be absolutely terrible, and I'm like, okay, that was a bad day, but like, we'll try again tomorrow. It'll be fine.
Yeah.
Good day though, I would say, honestly, like super chill. I say chill. I love to travel, and I think that is something.
You've gone on so many cute little trips. I see on your Instagram.
Yeah, I think I have an appreciation. I think too, like, if that had never happened to me, I don't think I would have understood the vastness of the world we live in.
Yes.
That, like, I remember in the middle of treatment being like, whoa, this is not normal, and this is not like what normal teenagers go through. And I think it opened my eyes earlier to the world than general high school population, you know?
Yeah.
And so coming out of treatment, I was like, I have been in isolation for 3 years, then COVID hit, so we were in isolation for a little bit longer.
Right.
But I've been in isolation. I want to go. I want to travel. I want to like see the world. I want to see God's work on this planet, and I've gotten to do that, and I think that has been really cool. And that's like good day. I'm somewhere new, seeing something different. But then also I do love to just be chill and to not take my health for granted.
Yes. So. Now, do you get to exercise? Do you have anything physical that you can't do because of all this stuff?
So I do have, high doses of steroids are a form of like chemo. I went through a lot of those. They're working on that protocol, trying to not have as many. But unfortunately, I was research patient at that point. So
oh, goodness.
When I was going through treatment, there was like, I would take steroids every like 4 weeks up on my maintenance therapy until week 101. And they were like, you can be put in this trial, and you will be randomized to either stopping steroids at week 40, or you just continue on to what we know works week 101. Well, in that decision, you're like, okay, if I stop at week 40, we don't know if that works.
Right.
If we go to week 101, I might have like joint problems, but like, can deal with that. So we didn't opt into that because I was like, I would rather have a full knee replacement than go through this again.
Yeah.
So I made it to week 98, I think, LOL, and I started having knee pain. And I was refusing to acknowledge that it was actually something going on with my knee until my mom saw me limping. It was like, Natalie, what are you doing? So she calls my nurses without me knowing, and she's like, Natalie, something. Well, this is a problem. So they did an MRI, and basically I have it in both my knees. It's called avascular necrosis. It's like basically destroyed cartilage.
Yeah.
In your joints, but it only affects my left knee.
Okay.
So I finished treatment. I had a scope done on my left knee, and he thought he could like basically rejuvenate what was still there. Yeah. It didn't work. I continued as if nothing were wrong, and 2 years later, I go in for my checkup, and he's like, I know you're in pain. Like, I can see it on your x-ray. You need to admit it. So he does another scope, and he was like, we're gonna have to do a bone graft. So I get put on a list for bone graft. This is the middle of college also. So
Golly. I
I'm
did
like,
not know this.
yes. So this is 2022. I'm out of treatment, but still dealing with it.
Mm-hmm.
And so I had my scope done, and he literally went in and immediately was like, you have to have a graft done. So I get put on a list for a donor, and that summer also the Lord ordained this perfectly, literally 5 years to the date. So I was diagnosed on July 24th. I started treatment on July 24th, 2017. 5 years to the day, July 25th, I have my knee surgery. And
Wow.
I remember I was so angry because I was so tired of dealing with it.
Mm-hmm.
And I remember we got the phone call that they had a donor, and that was like a whole thing. You're on a list.
Right.
He was like,
you don't know.
You could be called next week or in 2 years.
Yeah.
We don't know. So I remember when they called us, they're like, okay, we've got a need. You've got to be here on Monday. Like, we have to do it. And so I get there, have the surgery. Basically what they did was, instead of doing a full knee replacement, they removed the dead bone and replaced it with a donor bone.
Wow.
Very invasive, gruesome story.
Wow.
But I was non-weight bearing for 6 weeks. After that, started nursing school on week 6.
Wow.
Non-weight bearing. They couldn't give me the weight. Oh my gosh, I was so mad. But fully went to psych clinicals with a knee brace on. That wasn't safe.
Yeah.
But
Probably not.
No. But that was a big one, and now it's much better.
Okay.
I'm really glad I did the surgery. Will potentially still have a knee replacement in the far future, but it prolonged that.
So can you run? Or that's gonna make it worse, right?
So funny enough, before I had the surgery, I was starting to love running, and then I had the surgery, and this past spring, my whole family, the runners.
Yeah.
Oh my gosh, Dad's more of a biker, but we go for my checkup, and my mom, love, in the corner. So can she run? Because I was like, I wish I could, but it hurts.
Yeah.
And so he was like, my doctor was like, if you want to, I wouldn't go run a marathon, but if you want to, you can. And I was like, don't say that in front of my mother, because I really don't want to run that bad. And he was like, but if it's hurting you when you run, do not run. I was like, okay, well, it does hurt, so I'm not going to do it. But it's much better. I walk fine now. I'm really glad I had the surgery done, but it definitely it'll twinge every now and then. It's still there, and it's a reminder of
everything you've gone through.
Yes,
because people don't think there are physical repercussions to those treatments. It's so aggressive.
Correct,
and emotional,
yes.
and mental.
Yes,
but
I think other than my joints. When I finished treatment, they were like, you need to be going to every specialist and making sure, you need to be going to the dentist, you need to be going to the eye doctor, you need to be doing all of the skin doctor, you need to be going and taking care of yourself. So I go to all those appointments. I feel like I have a doctor's appointment every other week, but
I'm sure you do. Is ALL genetic?
No.
I couldn't remember.
So...
Because when you learn about nursing school, it's
some of them
6
are, some of
points,
them aren't,
and then moving on.
Yes, yes. Oncology very slim.
Yes,
learning situation in nursing school. No, they have no idea.
Okay.
It is spontaneous.
But it's the most common in kids.
Yes.
ALL. I did know that.
Yes.
I think that was on my boards.
Well.
I was like, oh, got that one.
Yes. It is.
But I didn't know if it was genetic or not. I didn't know if you knew that. Okay, so what would you say to, maybe there's a kid listening to this, maybe you share this with your nurses or whoever, kid, caregiver, somebody that's going through this very hard thing. What is 1, 2, 3, whatever you want to say, things that you would tell them to encourage them?
Yeah. I think from my point of view, it's okay to feel the hard feelings. It's okay to cry. It's okay to laugh. It's okay to make a dark joke. It's okay. Whatever. I think that is something that I would have benefited from if somebody was like, feel the feelings, feel every single one of them, but also, yes, there's a level of pick yourself up, like you're gonna get through it. I think in something I've wrestled with and learning and whatever is a lot of people ask the question, why God? Why did you do this to me? Why do bad things happen to good people? Why?
Right.
Like those big questions that like nobody has a great answer for.
Right.
I think I've wrestled with that over the past couple of years, and now working with these kids and seeing them, and like as bad as like what I went through was terrible, I'm humbled every single day I go to work. Like some of these kids have been through stuff that I literally cannot imagine. It is, like transplant itself is terrible, and then the complications that come with it, like watching some of these families go through what they go through, I'm like, it is awful. But and so I've had to wrestle with, okay, why God? But I think, and I've really recently just started thinking about this, like I read something and it was like the Lord cannot like coexist with evil because he is perfect. And I think a lot of times people say, why God did you do this to me? But he allows us to go through things, but he does not purposely give us those things. Like I don't think he was like, you're a sinner, you're gonna have cancer. Right. I don't think that's how he operates. I think he allows you to go through it so that you can understand and respect him and understand his love for you on a deeper level. And I think that's something I wish, like I would tell if somebody came to me right now and was like, why God? Why is this happening to me? My 9-year-old, if she would ask me that, I'd be like, he didn't. He's allowing you to go through this so that you can understand his love for you better and his perfection and his holiness. Whereas I think a lot of we get tripped up on like, oh, evil, God's in control, but he allows evil to happen. He allows it to happen so we can understand who he is.
That's beautiful.
Yeah.
That's so well said.
Yes.
Oh, you should preach the gospel over here, girl. Yes. What do you think you're proudest of after, like, I mean, even now, just like looking back and like reflecting, like, what are you proudest of going through all that?
I think. That's a hard question. I think.
No, I'm sorry.
No,
It's a loaded question.
It is a loaded question.
Sorry.
I am proud, and I've told this to people, and it sounds crazy, but I am grateful for cancer, which is a weird concept, and it sounds inherently by itself, you're like, what in the world? But I think it gave me a purpose. It gave me something to be passionate about. It gave me life again. Like I have a second chance at seeing life in a better light now. And so I think getting to carry that and like saying that the Lord didn't give me that, he allowed me to go through it, and that's a gift. And it allows me to be able to care for these kids in a way that not everybody understands. So not necessarily proud, but thankful. Very thankful.
Sorry. Also, I'm like 9 months pregnant. So I'm like, oh gosh. Oh, I just remember so much about it, and us, doing the runs and stuff for you at St. Jude, and it's so hard. You can't outside looking in. I mean, the only details I'm getting are from my mom.
Right.
Oh yeah. But seeing you like at the run, it's just like, what do you even say to someone that's battling this that you yourself have no idea? Like, what was the best thing people did for you that literally didn't know what you were going through?
I think from the outside in,
because they don't understand.
Exactly. And that's like, if you have the mindset of, I don't know what they're going through, but I can be there for them, I can pray for them, I can sit with them, meeting people where they're at. Like, I think that was one of the best things. I remember there were just some hard days, and I would go to the clinic, and my nurses would sit there and hug me and let me cry it out. Like, I think just, obviously, LOL, and I haven't been to therapy and somehow figured that one out. But, like, sitting with people where they are and not expecting more from them. Like, because there were some points where I was like, gosh, I feel like I'm not being like the person that people think I'm being. Like they think I'm this, oh, poor pitiful Natalee cancer child who isn't getting a normal life. Like, yes, but and it goes back to I didn't realize till college like my brother treated me normal was a blessing. Like having someone to be like making some dark jokes, like making it light of a terrible situation. I think it's good, but then I also think just being like, it's okay to feel what you're feeling.
And like just just how me knowing your family not super well, but like knowing your mom and like your brother more, of just like their personalities and like how God ordained them to walk through this with you, but also like in all of the weaknesses of what we all have, like He is stronger, God is stronger, and so just using Nathan's humor, bless him, just to help you. Or, using your mom where I'm sure she was shocked of like, I can't believe that I flushed her port or whatever she did that would make her queasy. Or your dad, like I had to shave my head with my daughter. Like, no human strength can go through that, No. And so the last thing before the fun question, we do have a fun question. I'm so sorry, everybody. This is very emotional. What is one thing that you would say to your family? Of just like, I know that thank you is like super loaded, or just what's something that you would say to them? I'm sure they're gonna listen.
Oh yeah, they're so excited.
Just about walking through that with you.
Thank you is so not even close to what I would say to them. I thank you, Lord, for giving them to me. To get me through that. I think. That's an emotional question, just because.
I know, I'm sorry.
No.
Now we're both crying.
I'm surprised it's the first time, honestly, that I've teared up this much. But I think, like you said, that's not something that that any of us could have gone through without, like, treatment, or without treatment, but, without the Lord. Giving my parents the strength to take care of their child. Like, and now I think seeing on the other side of it when I go to work and I see these parents, the parents honestly more heartbreaking to me sometimes, just because I know like they're helpless. And I remember my brother and my parents telling me, they were like, we didn't know what to do, like we didn't know how to help you, we didn't know, and you can't. There's nothing they could have done any better. But thank you to my family. Like I do not know what I would do without them, and I think. You're a 16-year-old and you're living in the same room as your parents.
Super fun.
Hello. I remember, like, they are my best friends. Like, my parents, my brother, my sister-in-law, like, my core family, they are my best friends. And I could not do life without them. And if there was a better word for thank you that meant the same thing, like, I would say it over and over and over again. Literally
I'm sorry I did that to you.
No, it's okay.
You're like, great, Dagan, thanks.
No.
I do have a fun question to end this off.
Okay.
So since we're on Tea Time with Dagan.
Correct.
I'm sure you saw this coming.
Yes.
But, do you like sweet tea?
I do.
Okay.
Which I have a funny story about.
Okay.
So, not really funny, but related to what we've been talking about for this hour.
Yay.
So, low immune system as a cancer patient, you can't have sweet tea.
No.
Because it, like, the bacteria in the tea leaves something or another. So,
what?
Yeah.
That is so sad.
Yeah, it was terrible. And I don't drink it as much now, but I loved it when I got diagnosed.
Yeah.
And
well, duh, we're from Ardmore.
I mean, yeah. Sweet tea and sun drop. I mean, I couldn't live without it.
No.
But, so, I remember when they were like, you can't have sweet tea. I remember being like, oh my gosh, what am I going to do?
Right.
Even Milo's is, like, not good. Apparently, like, it's not pasteurized. So, my lovely father, he would leave and just go find me stuff to eat, to drink, because I, like, would not drink or eat anything.
Yeah. And
he found some pasteurized version of sweet tea that was actually not terrible. I don't even remember the name of it.
You don't know the name?
No. Because I don't drink it anymore. I'm like, I want the real stuff now.
Yeah.
But it was like you had to find it in the most random places. It was like at the dollar store. I mean,
what?
Yeah. So
was it like Pure Leaf? Like that kind?
No,
Not like gas station tea.
not like gas station. It was good.
That stuff
It
weirds
was
me out.
like Milo's, but it was just
Okay.
So
Interesting.
I did have a whole situation with sweet tea during my treatment. But I mean, the second I got done, I was like, at one point, actually, I did convince my doctors. It was like getting towards the end of treatment. I was like, if my granny, because my granny's sweet tea is my favorite.
Okay.
If my granny boils the absolute heck out of it, like I mean, I will watch her, and we will boil it twice as long as we're supposed to.
Yeah.
And I have it, and they were like, yes, you're fine. Your counts are okay. So
that is hilarious.
yes.
So hers is your favorite.
Hers is my favorite.
Do you know what tea bag she uses?
No, I don't.
Interesting.
No.
My
And I
dad
don't even think it's the tea bag. I think it's the absurd
sugar.
amount of sugar that you put
Just like
in it.
cups. just pouring it in.
Yes.
Do you have like a favorite, like at a restaurant?
Not really.
Not
I
really.
think my dad's way more of a sweet tea drinker than I
Is
am.
he?
Yes. Yes.
Okay.
Yes.
Okay. Yeah, obviously mine is Chick-fil-A. It's a problem.
I do love Chick-fil-A.
It's so good. It's so
The
fresh.
little half sweet tea, half lemonade.
People have said they like that
That's
too.
good. That's
I haven't tried that. I'm just full on,
Oh yeah.
just the whole thing.
Yep.
Bless my child.
Oh yeah.
She's
They're
full
gonna
of
come
it.
out. She's gonna come out loving sweet tea.
Oh, well, thank you so much.
Thank you for having me.
I'm
I
sorry
literally
made
was
us
like,
cry at the end.
oh no. I literally was like, I have to use this opportunity
yes.
because I think the Lord put me through it for a reason.
Yes.
My verse the whole time was Jeremiah 29:11.
Yeah.
The classic.
I meant to ask you that. I'm sorry.
Mm.
So Jeremiah 29:11 is what you
Mhm.
held on to.
Yes.
Did you have any like worship songs or anything like that you also like went back to?
Yes. Lord, I need you. Hello.
Mhm.
I mean, yeah. Need you.
Hello,
real,
I need you
real
right now.
bad. Real bad. That was a big one.
Yeah, it's a good one.
Yet Not I, But to Christ in Me. That was a big worship song for me.
Mm.
I still love that one.
Yeah.
But Jeremiah 29:11, that one has come back time and time again at the most random. And that's one of those people are like, oh, can you take it out of context? It can, but also it means what it means.
Yeah.
And like it has come back to me at some of my lowest points when I need it the most.
Praise God for His word that it is living
Really.
and true and can literally pull us out of a pit.
Yes.
Literally. I'm so happy you're out of that pit
Me too.
and you are living your best life and you got to come on
I
here.
know.
I'm so happy.
Thank you.
Yes.